Alright, this presentation is going to examine the venous circulation of the systemic circuit. Part 1 of the systemic circuit, that particular video looked at the arteries. Now we're going to look at the veins here. So you can see in this particular diagram, this is the venous system. This is a pretty detailed diagram. I'm going to actually work with another one, but you can see down here, here's the greater trochanter of the femur. You can see the inferior vena cava here, superior vena cava up here, and then the veins of the arms. So why don't we go ahead and go through and take a look at this diagram and kind of walk through it bit by bit. What we're going to do is we're going to start here inferior and work our way back, because remember, veins make take blood back to the heart. So we're going to start farthest from the body and work our way back. If you have the blood vessel list for chapter 20 and you're following along on that list with veins, I'm just going to go right down that list for you. The first one on the list is the great saphenous vein. That's not shown here, but the great saphenous vein is a vein that it runs down the medial portion superficially in the leg, lower limb, and will actually anastomose with the femoral vein. So here's your great saphenous vein, and then that anastomoses with the femoral vein. And that femoral vein, once it passes through that inguinal ligament, it becomes the external iliac vein. I have both those right and left. The other thing that we're going to see here is that we have the internal iliac vein. And where the external iliac vein anastomoses, that then becomes the common iliac vein. You see the two common iliac veins, both right and left, anastomose, and then that forms the inferior vena cava, specifically the abdominal portion. If we make our way superior towards the heart, as the blood will be doing, we come in contact with the renal veins. And these are actually quite large, much bigger than the renal arteries. But these are the renal veins, so they take blood out of the kidney and put it back into the superior vena cava. Just superior to that, like we saw in the arteries, is the suprarenal veins, and that's the venous supply that takes blood from the adrenal glands and puts it back in the inferior vena cava. You may on your list omit the hepatic vein. Alright, now we continue up, and now we're in the thoracic cavity, which is up in here. And what we can see here are the intercostal veins. Now actually this diagram is incorrect. I haven't had a chance to redo it, but those intercostal veins do not actually join with the vena cava. Those intercostal veins actually join with what's called the azygous vein. And the azygous vein dumps right into the superior vena cava there, right at the opening of the right atrium. And so that azygous vein is going to take, for all intents and purposes, it's a little more complex than what's drawn here, but for all intents and purposes it is going to take blood from those intercostals and dump them back into the right atrium. And then you can see that the inferior vena cava continues upward and then empties into that right atrium up here. Okay, let's focus on the limbs then, and we'll just use the right limb here, upper limb. So what we have here in the limb is these are deep. These veins are deep. These here are superficial. So deep, this is our ulnar vein. This is our radial vein. You can see that the ulnar and radial veins will anastomose, and together they will then form the brachial vein. Those are the deep ones. Now superficially, we have this one that runs medial in the upper limb, and that one is called the basilic vein. This one over here is the cephalic vein, and that runs on the lateral side of the limb, very superficial. You can also see that off of the cephalic we get this little segue here, and this particular vein, kind of in the cubital region or antecubital region, kind of in the crook of your elbow joint there, that is called the median cubital vein, and that is commonly the site where blood is withdrawn for clinical testing. So we have the cephalic, the median cubital, which then becomes the basilic. The basilic then joins with the brachial to become the axillary vein. And then the cephalic and the axillary together anastomose to become the subclavian vein. Now we also have structures, vessels, veins, bringing blood back from the head. This one here would be an external jugular. This one here is an internal jugular vein. And those are bringing blood back from the head and the face and the brain. And then those two jugulars then, when they anastomose with the subclavian, form what we call the, and that's on both sides, they form the brachiocephalic veins. Now remember, we have the brachiocephalic trunk, but that's an artery and there's only one. But with this, there is both a right and left brachiocephalic vein, and so you need to make sure you indicate right and left to distinguish which brachiocephalic vein you're referring to. Now what happens is those brachiocephalic veins then anastomose, and then they form the superior vena cava. Let me draw for you the relationship between the azygos and the intercostals. I'll draw that better than that diagram. So here's the heart. There's the azygos connecting to that superior vena cava. Here's your inferior vena cava. So what we have is we have the intercostal veins from the right side joining. And then what we have is we have some vessels that kind of come across and allow those intercostals from the left side to join up with the azygos. So this is kind of a blind end there. So the blood would be coming in through this, crossing over there, okay, into the azygos vein. So here's your azygos. This one on the left side is called the hemiazygos vein. So all the left intercostal veins feed into the hemiazygos. They cross over on these little shunts here, and then eventually all that blood makes its way into the azygos and then up into the superior vena cava. And that's all that I have for the venous system.